Me to start by congratulating you for the good news in the family.
How do you know?
Mr. President, I'm a nation editor. It's my business to know. But I should start by congratulating you.
Thank you very much. I
on this very good
appreciate that.
news. Yes, I know you must be very happy about it.
Very excited.
Yes, yes. Secondly, I will ask a typical question about your day. How is your day like today compared to what it was on March the 3rd? How has this whole situation affected the way you operate? How do you organize your day when you have to maintain distance between nearly everyone and nearly everything that you do? How do you organize your day by Zoom rather than having people one-on-one? So how is your day like now, Your Excellency?
Well, let me say that my day is pretty much the same as it always is. The only difference, exactly as you've said, is that whereas maybe previously you were having more face-to-face engagements with people, today, unfortunately, as a result of what is facing us and this virus that is abound all over the country and all over the world, you're doing exactly the same thing but using more or less technology. You know, we start every morning with our security briefings from our various agencies. You start with the police, the military, the intelligence teams. And you get your daily update, what has happened, what has gone on through the night, were there any incidences in the borders, were there any issues across the country. And those briefs continue, and as you discuss with them individually and sometimes collectively, agree on the kind of posture that you will take for that day. Then from there, it is engagement with those charged with various responsibilities, various ministers, sometimes directly to permanent secretaries, especially in areas where I have pet projects that are very keen on seeing progress and move forward. NMS also, you know, for example, came on board just as COVID was just about to hit us. So again, you get those kind of briefings, and then during the rest of the day, you also have and continue having meetings with regional leaders, with leaders on the African continent, with global leaders, where again you continue exchanging ideas as to what is happening, how are you handling, how are you managing, focusing on ourselves, especially with our development partners, on the areas where Kenya can get assistance. So the day, a little bit with less people that you come in contact with, the day is pretty much the same.
Let me also ask a question that my pastor insists that we must ask everyone that we meet in the midst of all this depression and people worried and want and desperation, which is to ask you, how are you doing personally when you see all these things? You know, when you see
yes, I'm doing okay.
Yeah, the planes parked at the airport.
Yes,
The
I am doing fine. But let us also be frank that it is a very challenging time. As a result, again, of this disease, you know, many sectors of our economy, as you said, aviation, the horticulture industry, the flower industry, the tourism industry, the hospitality industry generally, you know, the bars, the restaurants, all these are hurting, and they employ huge numbers of our people. So, of course, it's very disturbing, you know, because you imagine these are all very hardworking, capable, honest Kenyans who used to wake up in the morning and go about their normal work. And it is disturbing that now they're in a position where they are living very challenging lives. And as head of state and as leader and as the person responsible for government, it concerns me, it worries me on an ongoing basis, right? It worries me, it concerns me, yeah? And you are constantly battling with that issue of, yes, we want life to go back as quickly as possible to normal so that people can continue with their ordinary normal lives and the economy can rejig itself and get back to where it was, and these people can be back at work. But at the same time, looking and recognizing the very real danger that if we go about it too fast and without a plan, we will be digging graves, as we are seeing happening in many parts of the world today, where people have taken this disease as not serious, and we have seen the consequences of it. Yeah? So balancing between life and livelihood, these are not easy challenges, and I can admit that it has been very difficult. It has been very difficult because I know people, yeah, sometimes personally, yeah, and they're saying, why don't you open up? Then at the same time, you have other people saying, no, we don't want to open up because of the dangers, you know. And trying to balance this is not an easy course, but we try, we manage. I am grateful for the many people who are also around me, who we talk with, who are advising, who are giving input. And at the end of the day, we just want to ensure, first and foremost, which is, as I have always said, the priority of any government, to protect life and property. So we must focus ourselves on our ability to protect life and property. And as much as the economy is also important, but that must come secondary to life, because, you know, there is no point of having an economy in and amongst people who don't have life. So it's a difficult balance, but we try, and we're pushing, and we're very grateful to God, because Kenya has not, so far, God willing, so long as we all continue to observe the protocols that have been set, Kenya has not lost as many lives as we have seen in other parts of the world.
This one again is for a favorite quote from my pastor. I'm talking about the pastor a lot these days. This is the season for pastors. And he quotes a guy called Max Dupree, saying that the first responsibility of a leader is to define reality. So for the millions of Kenyans who are going about their very difficult lives at the moment, how would you paint the picture for them?
I want to paint a reality picture that tells us, right? We're a very young population, right? And as a result of that, we are able somehow to bear this virus a lot better than much older populations. And as a consequence, much younger people feel, why should I bear the responsibility? I want to go about my business, yeah? I'll survive. And as to give a personal experience, you know, I have a young son also, yeah? Not young, but he's a young man, who happened to be, was traveling to Mombasa with his mother when all of this happened, so they were caught out in Mombasa. They are still there. Huh? And because of now the confinement rules that we have put, they can't move back. And he decided one day that he wants to go out. And I asked him a personal question, and I told him, you know, it's fine, because it was reported to me by some other fellows that he had done that. Huh? So I said, okay, you've gone out, right? You've had your fun and you've enjoyed yourself, right? But now you've come back and you're with your grandmother. Your grandmother is 80 plus, right? If something happens to your grandmother as a result of what you have done, yeah, how will you live with yourself? Because it's not about me. It's not about listening to me. It's about how you will live with yourself, right? So the reality is that the situation that we have is a very personal and individual responsibility. It is not about what the government is telling you to do. It is not about what the president is telling you to do. It is not about what the Minister of Health is telling you to do. The reality of today, yeah, is about what are you yourself telling yourself to do to protect not just yourself, but those you love. That is the reality.
Let me just ask the question of the risk assessment that is being done and how you're balancing again those two issues of life and livelihood. And in your own perspective, how do you see it playing out? When do you think it would be safe for some level of normalcy, if we can call it normalcy? When can we begin
I think
to...
like I said when I spoke last weekend, yeah? We can't be in lockdown forever.
That's true.
All right?
That's true.
We have to reopen our economy somehow.
Yeah.
All right? As much as we're seeing cases rising, we're seeing more people recovering and not so many people passing on as a result of this virus. So, moving forward, and as we come closer to reopening our economy, I want to go back to what I've just told you. This shall be a factor of our personal responsibility, because we have seen those countries that have basically reopened. And what has happened? We have seen a second wave. We have seen a surge, yeah? Of this disease. Germany is a perfect example. Yeah? Singapore is another example where they had really managed to contain it, but when they started opening up, we saw a resurgence. Right? So, as we move there, how disciplined are we as Kenyans, right, in maintaining and observing the protocols? Are we, if we say we're going to open up and say, well, we're opening up, everybody must wear a mask, yes, as you go about your duties, yeah? Are you going to be coughing into your armpit, as we have been told to do? Are you going to be social distancing, as we have been told to do? Because that is going to become the new reality. We are all very hopeful that a vaccine will be found, but even if a vaccine is found, by the time it gets to some of us, it's going to take some time, right? So it boils down again to this issue that I'm saying, you know, it is about my responsibility. My responsibility, first and foremost, to myself, my responsibility to those I love and who are around me, my responsibility to my neighborhood, my responsibility to my country, right? That is going to become the new social norm. And if we are able to abide by this new social norm, I strongly believe that we can get back to as close a place as possible to where we were, all right? But we must recognize, right, that we're still a long way from it. So it is your individual choice, it is your individual responsibility that will determine how successful we shall be as a country to defeat this common enemy that we have, an enemy that knows no color, that knows no tribe, that knows no age. Because even as we are saying, it is affecting those who are much older more, yeah? We also know that young people are also getting affected and are also dying, all right? But the big debate is, okay, so will they be able to appreciate and understand, right? That going back to school, going back to your lessons, yeah? Going back and facing exams, that you will also be going home and you will also be engaging with others, you know? Will you be able to take on your responsibility? These are some of the things that will determine the future of our country. You know, we're a country that believes, trusts, and worships God. We love our Sundays. We love how we mingle. We love how we come together as families, as Christian families, as Muslim families on Fridays, right? But at what risk? At what cost? Yeah? You know?
Quite apart from what we do internally here, there are also other factors that are not necessarily local. I mean, even the origin of
This is not
the
local.
virus.
It's not just the disease was absolutely-
somebody went and had bat soup somewhere,
Absolutely.
and then there was a mess. Regionally, we are taking this in a different manner. There are countries that believe that this thing is finished. It's not a problem. There are other countries that are probably not being very forthright in the management of their data. There are countries that are unable to manage their health systems. And all these people are neighbors, and our borders really porous. So how does that factor into the way we manage them?
Exactly as you said, you know, people are taking this thing differently. Just as we individually are taking it differently, you know, you find, I cited a number of examples when I gave a press conference not too long ago, you know, of people who thought, you know, they were cleverer because they were able to go and con their way around roadblocks and what. And what did they end up doing? They ended up taking this disease to those that they love. So who lost? The government didn't lose. I didn't lose, right? It was those that he loved who lost. So he may have smiled as he went through, but at the end of the day, the cost and the problem was to himself and his loved ones, equally, right? Which is what, again, we are seeing across the globe, even before we come to our region. There are those countries that are taking this thing seriously and managing it in that manner and putting in place protocols. But there are also others who are saying, well, this doesn't exist. It's a small flu, right? Right? I don't want to mention countries. That's not my business. Yeah? But those people who have been talking about small flu, yeah, today now, I think are ranked second highest globally.
Yes.
In terms of both infection
And
death. As a government, my first responsibility, yes, is to engage with all our global partners, is to engage with all our regional partners, but my first priority is to safeguard life and property of Kenyans. Yeah? That was what I am charged with. That's my first responsibility. And so therefore, my engagement with everybody else must be based on that. All right? So, as you saw the other day with another neighbor of ours, a good neighbor, a friend, we are actually not even neighbors, we're more like brothers and sisters, yeah? But if you feel your home is secure, right, then I can't make you, force you. But I must tell you, yeah, that these are the rules, these are the protocols that I am engaging in my home, yeah? So I want you to come, I want you to share a meal with me, I want you to partake and we develop together. But in my home, these are the protocols you're going to have to observe, right? And that does not mean I hate you, yeah? Just like you will go to your neighbor's house, yeah? If your neighbor's house, the wife tells you, before you enter my house, remove your shoes at the door, you remove your shoes and before you go in. In your house, maybe you don't remove your shoes, you just walk in with your shoes. But your neighbor, that is the protocol they have in their house. That doesn't mean that she doesn't like you. Just as ukiingia kwangu, wacha viatu kwa mlango. Yeah?
For a very long while, we thought that it's all about the economy. This is Nairobi, a month now into the coronavirus pandemic. Our streets are deserted and abandoned. We are at war with an invisible organism, SARS-CoV-2 or COVID-19. Frontline workers fighting this war. Doctors, nurses, clinical officers, laboratory technicians, morticians. We are working in high-risk environments, long hours of work to serve the human race. We acknowledge all that has been done by the government in the mitigation measures for procurement of medical equipment and supplies, for hiring of more healthcare personnel, but we urge that we need more personnel on board. Adequate personal protective equipment, our healthcare workers compensated well to be assured of their safety, protection and welfare. Our healthcare facilities to be improved to ensure that we have adequate ventilators, critical care units, isolation and treatment centers across the country. More than that, we need you as the public to support us in this war. Practice social distancing, wash our hands regularly, walk around with sanitizers and sanitize before you get into any building. Put on your masks when in public spaces. Stay at home and only come out when necessary. But most importantly for us as healthcare providers, when you come to the facilities, please disclose your full medical history. My name is Dr. Chibanzi Mwachonda, the Acting Secretary General, Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, the Doctors Union.
This is NTV.
In managing this crisis, is there anything that you have observed that gives you hope?
Yes, I have been very inspired by our frontline workers, our health staff who have really gone out of their way to doing their work. I've been very impressed by our contact tracers who have done a magnificent job in trying to, and contact tracing, which has worked very successfully, at least so far in our country. I'm very impressed also with our security agencies who have actually been forced to work overtime, in order to enforce the various curfews and the various lockdowns that we have had. But more so, I've also been impressed by the majority of Kenyans who have chosen to obey, the rules and protocols that have been set up. And I believe it is because of the combined effort of Kenyans and all these different services, that has so far, enabled us, to have the limited number of deaths. And the only thing I will keep telling Kenyans is don't be fooled by success. You know, success creates laxity. Watu hawajakufa, hii kitu haina tabu. Don't be fooled, because you haven't died because you have observed. You haven't died because you have followed protocol. Don't now say, hakuna mtu amekufa, hii kitu hakuna. No, the reason you have not died is because you have followed the protocol. Let's continue to maintain our stance in following the laid down protocols. Then we shall survive, then we shall overcome.
With all the data that you're getting and all the analysis that you're getting from the experts, how do you see this developing? When are we going to peak?
Well,
in what kind of
according to the experts and the technical people, they say we peak in August, September, right? My hope, of course, as and this is now me, you know, and at the end of the day, I have to listen to the experts. Right? But my hope is that if we continue working the way we are working together as Kenyans, right, we will reach our peak much earlier and have fewer deaths, right? That is going to be dependent on every single person, yeah? And that's why I keep saying it is the individual, it is the individual, it is the individual. And it is that son of mine I was telling you about who has to ask himself, that's where you are. You can't come home, you are with your grandmother. Your grandmother's life is in your hands. You see, it's you to decide, and to ask yourself, if something were to happen, how are you going to live with yourself? Yeah? Just because of one evening out to go and see your girlfriend or go and see what? Yeah? How will that help you? Yeah? How will you live with yourself if something happened? So it is the individual at the end of the day.
Okay, and you're satisfied that we have sufficient resources to manage the...
I am very excited by the fact that we are now making our own masks. We are not having to import masks. We are now making our own PPPs. Yeah, what do you call these personal protection equipments? IOTE, PPEs. We are making our own, right? And we are continuing to do that. We are supporting others also in that endeavor, in supplying and helping. Through our development partners, getting additional equipment. One of the greatest things that happened is that we had already equipped a lot of our hospitals across the country with some of the equipment that was necessary. We are adding, to that. We have a lot of our innovators out there who are looking to see how we can even make additional equipment. Yeah? We have a lot of our young people who are out there looking at different applications that we can use through our telephony systems and etc. Yeah? And these are also growing and developing. So in and amongst the challenge, there are also a great deal of opportunities that are coming out there, yeah, that are exposing Kenyan innovation and Kenyan talent and giving it opportunity. Yeah, before, I mean, masks, we were looking initially. Now we're making them. Yeah, we're making them more adaptable. And as you heard the ministry saying the other day, some of our own PPP equipment that we are now using is probably better than even the imported materials we were getting before. So these are good things, good signs.
Yeah. I think I will probably rest COVID a little bit, so that we can talk a bit of politics also.
So all this is going to, so politics is also going to take another hour.
As a politician, I'm sure you'll enjoy the discussion probably more than I will. Let me just ask a direct question. Is BBI still on?
Absolutely. Absolutely. And I say that with, the BBI process is one area where I have always wondered why we are politicizing this process. Because what is it about? It is about bringing people together. It is about trying to end suspicions, not create suspicions. If anything, it has been one of the most transparent processes, as far as I'm concerned, that we have had in this country for a long time. Because from its inception, to ultimately, despite a lot of people being sensitive, we went and we ended up in Bomas of Kenya. The document was read out. All the suspicions people had said, oh, it's okay, right? And then from there, people want to continue to politicize. But what we said was, let's wait now for the documents. The only problem we have now as a result of COVID, maybe it's delayed, okay? But the process is still ongoing. And mine is to ask Kenyans, let us support this process of trying to make Kenya more inclusive. Let us support this process of trying to ensure that our country shall never again engage in political violence as a result of ethnic animosity. Let us create an inclusive society, right? Because this is ultimately the objective of this BBI. We could wait and say, okay, we'll just wait for the next election and wait for the normal tensions. I chose, no. I don't want to go that route. I want to recognize that from 1992, when we started our multi-party politics, every election year, except 2002, every election year has been faced with ethnic or political violence or challenges of one reason or another. So I decided, I'm not going to sit down and wait for the next election cycle, and then when we already know what it shall bring. No, let us come together. We may not agree, all of us politically. We don't. Yeah? If we did, we wouldn't be a democracy. Yeah? Okay? We are different. We have different political positions. But let us at least create an environment where those different political ideologies, positions, can be expressed and shared, and people can go to an election, yeah, without shedding of blood and destruction of property. Yeah? And I believe I have a responsibility to do that, and I would be very proud if I was able to achieve that. So for all those who may be, for one reason or another, against this process, please, I say, let's support it. Let us together digest it. It is not for anybody or against anybody. This is just to help us deal with a problem, yeah, with a cancer that has afflicted our country. And all we're saying is we need to cut this cancer out.
When you were launching the Jubilee Party in 2016, you used very poetic language to express your aspirations about what you wish the party would achieve, which is generally along the lines of what you've said, national unity and stability and all that. That the aim of the party was to express the beauty of reconciliation and collective purpose. Is the dream still on?
I believe so. I believe that's that is what this is all about. It is about that same dream. It is about that same dream. Yeah? That it is possible, for example, yes, for two communities who were at loggerheads, at war, yeah, where a lot of killing happened, where a lot of destruction happened, to come together and be in one government and forgive each other, right? Okay? And that's what Jubilee was all about, right? Bringing them together. So why then can we not extend that exact same principle, yeah, to others, you know, out there? Welcome, yeah, all right? You may not necessarily 100% agree with all the Jubilee ideals and agendas, but at least on this one, yeah, I will do everything in my power, yeah, to reach out to every corner of this republic and say, look, I want you to recognize that this is your country, this is your government, and you, irregardless of where you come from, irregardless of your color, irregardless of the language that you speak, yeah, must and will feel at home in this country. That is a principal agenda of Jubilee, right? And that is why I have reached out. I have not reached out to break what we have. I've reached out to extend what we have to the whole country. And I will not stop in that. I will continue. Because I believe that's what this country needs. That's what this country needs.
There's been a lot of activity in Parliament, whipping, de-whipping, some people getting jobs, other people getting them. Overall, is this a systematic process? It's just a record?
Look,
internal.
I made it very clear. You know, everything that I have done or I'm doing, yeah, especially with the start of my second term, there are a number of things I promised. In Kasarani, I promised that I would do everything in my power to achieve my big four. I said it there, and I'm still following on that route. I said I would do everything in my power to end corruption in this country. I said it there. I have not done anything against or deviated from that path. And Mutuma, me, I'm saying, don't base it on what I'm telling you now. Just go back to your office. I'm sure in your archives, just tell them, I want the speech the president made in his inauguration. So as a result, of that. Yeah? I want people who are not going to fight that agenda that I laid out and made to Kenyans. I want people who are going to support that agenda. All right? So if you feel you're not able to work in tandem with my agenda, please then, why don't you let me put somebody, yeah, who is keen and eager to help me fulfill that agenda that I promised Kenyans in 2017 for the second time and in 2013 for the first time. That's all. So me, I'm not against anybody, I'm not for anybody, but if you feel you're not comfortable, then I say, then this gives you now free time to engage in whatever you want to engage in, but this position is these positions are very critical to me and my fulfillment of this agenda. So let me put somebody who is willing to put their time and effort into it, and then it also frees you to do that which you please. You know, that's what democracy is all about after all. Yeah.
Let me ask about the IABC. We may have a referendum, we may not have a referendum. Do you have confidence that IABC would be able to conduct?
I don't want to comment on that, but I know that there are people out there and the different political groupings, especially in Parliament, who has the final responsibility, who are looking to see what is the best way forward on that. I don't want to give an opinion one way or another because it would not be fair from my seat for me to say this, whether good or bad. I don't think it would be correct. There are a number of by-elections ongoing and other things. Now, if I was to say or answer that, I want to say that I am neutral in that debate. There are those who are engaged in it, and we wait to see what the outcome of that debate shall be.
How differently are we going to manage the economic stimulus process and resources? Because, you know, in the past, we've had all these complaints. You have a good process like that, but the detail of the way it's managed, you have issues. So how differently are we going to take it to make sure that...
I think basically, if you look at the process that we have, and that's why I said, I sought to depoliticize it this time around. I sought to say, let us use the Nyumba Kumis, let us use local administrators, let us use local, religious leaders to pick and do all of these things. Let us also increase our use of technology, And that's why, for example, as I was saying, even in terms of food distribution and so on, I've said, no, let us identify the persons, let us give them the cash, let them decide what to buy. Let it not be that we're going to brokers and other cartel groups to buy food and go and distribute. Give the individual the money. Let them go out there. Let them do what they need to do. That's why I've also focused around and saying, let this particular stimulus be about especially wale wananchi wenzetu wa mashinani. And that's why we're actually calling it kazi mtaani, so that we start to develop our inner cities, we start to develop our slum areas, and using their own labor, because they are the ones who know where their problems are, shida zao ziko wapi. We focus, on that. And again, this is the other reason why I am very keen and I will not stop in pushing my fight against corruption, because it is corruption, it is cartels that have driven and have made a mess of some of the previous interventions. And that's why I've said I don't want political interference, I don't want interference let the decisions be made at the grassroots level. Let the people there decide who deserves, who needs, who should be working, and we roll this program as opposed from top saying this is what you're going to do. Let it come from bottom up. Yeah.
From a personal perspective, what would you like your 2 terms to be remembered by? When people remember President Uhuru Kenyatta in 2056, what should come to mind?
I want to come to mind that we had democracy.
Yes.
Yeah? I am the first sitting president, number one, to vie and lose and accept. I'm the first sitting president to vie, win, and have an election nullified. And I accepted that, right? I'd like to be remembered for everything that we have done as the first president under a new constitutional dispensation to put in effect, despite the challenges, a whole new structure and system of governance. I'd like to be remembered for the railway. I'd like to be remembered as the first president who did 10,000 kilometers of road when it took, 100 years to do 10,000. I have doubled the number of roads that we have done in this country. Right? These are, I can list Mutuma, and maybe one day I will show you. As the one who has once again revived the railway sector again, as the one who has revived Kisumu Port, is now operational and moving, as the one who did the first tarmac road to Lamu, as the one who first did the first electricity lines into Garissa to put them onto the grid. These are small, many. Many Mtuma. Many. Ukitaka tuhesabu nitakupatia kitabu iko size hii.
I think we can start there, Your Excellency. Yeah, so thank you very much. Thank you for your candor and your accommodation.
And you're always welcome. Yeah. And anything that you need, anytime, karibu sana.
Yes, sir.
Huku ni kwenu. Hata kama kuna COVID.
I came with my colleagues, Joseph Warongo.
Wakuje tupigwe picture hapa. Great stuff, guys.